And the question is, why are we talking as food as medicine? Most of us went to medical school, but when we went to medical school, they didn't give us any nutrition classes. But yet we were expected to deal with patients. And the fact of the matter is, of the 10 leading causes of chronic diseases, at least a half of them, maybe even 7 of them, are related to poor food choices. COVID began to spark the interest in how does nutrition help with the immune system. A study was published in the JAMA, the Journal of the American Medical Association, and it was looking at plant-based meat alternatives, and specifically it was looking at the Impossible Burger and Beyond Burger. The question is, are those plant-based? Is this whole food? The answer is no. These 2 burgers are calorie dense, they are scientifically engineered, they are highly palatable, but they are not whole food. So what is a plant-based diet? Not every plant-based diet is really plant-based. Every fatty meal causes an inflammatory storm, and the endothelium is stunned. I believe that it is almost malpractice to tell our diabetic patients that a high carbohydrate plant-based diet is not the best diet. And I think we need to share with our patients the evidence that says that indeed these foods are appropriate.
Welcome, welcome. Good morning, good afternoon, good evening, wherever you are in the world. I see a few people have checked in already from Australia, Delaware, Oregon. So we have people really from all over the world. I am Dr. Sal Lacanina. I am the medical director for the Lifestyle Medicine Institute and the CHIP program. So I want to welcome you to another program, which I can tell you is going to be fun and exciting and informative. As you can see, we have from the promo, we have Dr. Lyndi Schwartz coming on in a few minutes. I want to just give you a little bit of background about Lyndi before she comes on. She was actually born in Trinidad and Tobago in the West Indies and immigrated to the United States when she was 12. She settled in College Place, Washington, and that was the home of Walla Walla University. I like that name. It rolls right off your tongue. Where her father was actually a professor of philosophy. So she graduated from Walla Walla College and then went to medical school at Loma Linda, graduating in 1982. We have to keep the dates out of it because we don't want to know how old she is. I'm not going to tell you how old I am. After medical school, she stayed at Loma Linda and did an internal medicine residency. And then she actually met her husband after residency, and they moved to Kettering, Ohio, where she's currently working at Kettering Medical Center. She's been there for 31 plus years, involved in teaching and administration in the internal medicine residency program. She's actually the program director for the residency, which is fabulous. Personally, she supports a number of ministries through the Seventh-day Adventist Church, which includes both a health ministry and a theologic ministry, which is really so cool. And she's been blessed to speak on 5 continents on issues of health and the gospel. She does short-term mission trips, and she's passionate about nutrition and the science, which is something that we'll definitely get into today. You know, the science of food and nutrition and lifestyle medicine. Just as a reminder, we have a chat box. If you have any questions, please put your questions in the chat box. We also have a few poll questions, which we're going to put up. But without further ado, I will ask Dr. Schwartz to join me on the screen. Hello there. How are you?
Hello, Dr. Sal. I'm doing great. It's just wonderful to be here. Thank you for having me.
Yes, pleasure to see you. Would you like to have the audience do the poll questions first?
Yes, I think that would be very helpful.
So which of the following is the number 1 source of calories among Americans aged 2 and up? And you can see sugar-sweetened beverages, desserts, breads, bagels, rolls, cheese, and cheese products. So Dr. Schwartz is going to give us the answers throughout the program, not now. So we're going to keep that all a secret. And then we'll give them a minute and we'll get on to the second question in the poll and see how brilliant our audience is. We have the most brilliant audience. I didn't tell you that. We have people literally from all over the world that join, which is so cool. And then the second one there, which types of foods which types of foods are most protective against type 2 diabetes, which, I think could be really classified as a pandemic in and of itself, which is amazing. So cruciferous vegetables, berries, whole grains, and fish. So very cool. So tell us a little bit about your journey into plant-based eating and nutrition in general, because as you mentioned in the trailer, none of us, even till today, really get schooled in the area of the science of nutrition. And that is so unfortunate, especially with the students in medical schools and residencies today. So what was your journey?
So that is such a great question. And, it's really become a passion of mine. I was raised as a plant-based vegetarian. And what I can say is that when we were growing up from the West Indies and when we came to the States, much of what my parents presented to us as food, we didn't really embrace because, for example, and my mother and I were talking just the other day, she loved watercress. And she put watercress in everything, and we didn't like it. Additionally, she made her own homemade bread. She did not believe in anything but her own 100% whole wheat bread. And that's a totally different story. That's very funny. But anyway, we thought it was crummy bread because it was so crummy. There was nothing to stick it together, but we had to eat that. And then she would make us bean sandwiches with that crummy whole wheat bread to go to school. So it was really quite funny. But really, what has sparked my interest in nutrition, as I've come to appreciate how my parents raised us, is I have had patients, young patients in their 20s with diabetes, losing limbs because of ulcers on their legs, hearing physicians, colleagues, kind of almost just in painstaking anguish that some of these patients wanted fruit and that they can't have fruit. And I was like, yes, they can. Or even people saying that, you shouldn't eat fruit. It's just sugar and things like that. A lot of misinformation. And so I began to think and realize that out there in the medical community, the vast majority of clinicians are really ill-informed or uninformed about the importance and the impact that diet, that good food choices have on health. And that was one issue. Another thing that happened to me that really began to make me think and do a lot of research, read hundreds of articles, was a resident that I had that said that, I can tell you the story fully later, but he experimented with the plant-based diet for 1 week, and the guy was already brilliant. He said his mind cleared up, and I thought, what is that? How can the mind clear up?
Right.
That's how I really got my passion for plant-based. My upbringing, the patients that I see, and this one resident that was kind of the first person to get in my mind that there is something about plant-based eating that changes your life.
Right. So we'll tell the audience, just before the program, we were chatting about the food in Trinidad, and we'll see if anybody knows what roti is and jerk chicken.
Well, I never had jerk chicken, but that roti, if anybody knows, they deserve a prize.
Right. Well, I like the fact that you brought up the unfortunate fact that many young people now are being diagnosed with type 2, which we know is an adult onset diabetes, and we're seeing pediatricians diagnose that in adolescents. And I'll have to give a shout out to, do you know the guys that did the book Mastering Diabetes? Cyrus Kambata and Robbie Barbaro. Yeah. So they are testaments to the fact that you can eat fruits and vegetables and have an A1C of 5.4.
Absolutely, yes.
So you're going to dispel the myths for us, but I know you're going to also talk about endothelial inflammation, and you have some slides which I'm really anxious for the audience to see.
So let me first begin by kind of laying out something that is really a concept that's really important, and a framework that I've used with my patients and in speaking kind of all around as I've traveled around the world, speaking about this topic. First of all, I think one of the saddest things is to recognize that of the leading causes of non-communicable diseases in the world, at least 5, if not 7 of them, probably 7 of them are really related to suboptimal dietary choices.
Right.
People don't appreciate the magnitude of their food choices on their health. And so that's the first place to begin, is recognizing that our food choices really have implications for our future health. That is one significant thing. Another thing that's really important that I've noticed also is that there is an organization, and it's the Global Burden of Disease Researchers.
Mm-hmm.
Every year they publish their data. And one thing that they have said about food is that what we are not eating is killing us.
Mm-hmm.
And I think as physicians and healthcare providers and so forth, we need to recognize that we need to appreciate what is it that we are not eating that's killing us. As a matter of fact, if you look at the United States, I mean, the United States is a first world country, top of the top. Yet in terms of death rate, and death rate being measured as number of deaths per 100,000 population, we rank behind Rwanda. How could that be?
Isn't that amazing?
Crazy. So yes, and it really has to do, what they look at is what is the quantity, they try to quantify the attributable risk of specific dietary factors on cardiovascular disease, cancers, and diabetes, type 2 diabetes. That's what that's about. Let me just show you this this first slide here, and audiences around this very quickly. Let me show you this. Yeah. I like to kind of get them conceptually to think of food in terms of healthful choices, unhealthful choices, because those are fairly black and white, and then debatable choices. As you see very quickly here, the healthful choices are whole grains, legumes, vegetables, fruits, etc. The unhealthful are the processed meat and things. And those two there is broad consensus in the evidence in these two categories. So the red box foods, as I call them, there's broad consensus that these foods promote harm. Whereas in the green box, these foods promote health. Now, the yellow box is only yellow because it's being compared to the red box. And the majority of Americans eat their food in those two boxes, the red and the yellow. Let me go to the next slide very quickly, just to show you this. Now, the bold print on that slide there, it tells you that 70% of the calories come from processed food and ultra-processed food. Now, what's interesting about that 70%, it doesn't take into account that actually of the 30% that appears to be, okay, that's fine, it's not really fine, because 14% of that comes from meat as well. So if you look at the population in general, probably only 14% of our calories come from health-promoting foods. And so that is really a significant thing. Yeah. And that's where I like to begin discussions, just in terms of looking at at the kinds of categorizing food. That way people have an idea how to look at things.
So how do you help your patients then? I like that you focus on food choices. I read something recently, we probably make about 100 choices per day that significantly impact our short and our long-term health. So how do you counsel your patients and your CHIP participants and all into making the right choices and just thinking on a daily basis, what choices am I going to make today that really will keep me healthy?
Yes. There are a lot of myths, I think, out there about food. And so first of all, dispelling myths is really helpful. I'll get to one in a minute, but we don't really appreciate the implications of, for example, meat. And so I try to talk to my patients about what meat actually does. I have another slide that I'll show here, but what meat does. And so what I do is I approach my patients, I assume that, and I believe that people are pretty smart and they can grab hold of data. And so I do that. Now, let me tell you a couple of things I do, then I want to go over some things. I actually refer them to resources. So I have them all look at the video food as no, forks over knives, forks over knives.
Yes, yes,
I
yes.
have I have a sheet that I give to all my patients, and one of them is forks over knives. Then I also have a book. I have them read the China study, and then I have a series of recipe books, and then I begin to go over some of the science and the mechanism of disease. One of the funnest things to deal with is diabetes, liberating people, patients to eat better, healthier things that they didn't think were even possible. You know,
Right,
like
right.
fruits and so forth. I'll come to that, but that's how I approach that.
So that slide, you know, is really interesting. When I looked at that before, the impact that meat actually has.
Yes,
I think intuitively people really need to hear that, and they need to see
yes,
the reality of what
yes,
happens
yes,
and make that link between food, especially meat products, and heart disease. So
yes.
maybe you want to put up that slide and give the audience
Yes,
some education and information on that one.
yes. I'm going to show two slides. This slide is ultra important.
Yep.
And the reason it's so important is this. This is a concept that is new to me as of the last 4 years or so. And because it relates to something that connections that we don't generally make. So the idea is this. First of all, in 2005, red meat emerged as a public health concern. That was in 2005. The mechanism now began to unfold over the years after that. And this is how it goes. So people think they eat meat and big deal. Well, the fact of the matter is, tied to everything that we eat is the gut microbiome.
Right.
And that's important because we have actually in our guts about 40 trillion bacteria. Can you imagine that?
Yeah.
And our diet actually shapes the kind of bacteria in our gut.
Right.
And so if you look at in this picture, in the image itself, there is some food. There's the gentleman. There's some food there, and we see what looks to me like a steak. Now, I've never eaten meat, but there's a steak there, and there's some eggs and fish. It turns out that foods that are high in phosphatidylcholine, which is a substance, or L-carnitine. So phosphatidylcholine is seen in eggs, fish, dairy products, and L-carnitine is seen in red meat. When you eat this stuff, phosphatidylcholine that is in the food is high in that, or L-carnitine, those two substances become metabolized by the gut into trimethylamine. Now, in order for it to do that, though, the person has to be a habitual, long-term eater of these kinds of food. In other words, if a plant-based vegetarian decides to eat an egg, an omelet, this wouldn't happen because the gut bacteria doesn't do this. The gut bacteria have been conditioned that when they see these substances, it's converted to trimethylamine. Now, trimethylamine is oxidized in the liver to trimethylamine N oxide, TMAO. That particular substance is very, very dangerous. It causes atherogenesis. It also decreases the excretion or the clearance of cholesterol in the bloodstream. It does a whole host of things and causes strokes and heart attacks and congestive heart failure. We're not aware of that. The interesting thing is the Cleveland Clinic has done a lot of work on this substance, TMAO. And if a patient goes to the hospital with a heart attack, they can measure the level of TMAO. And based on the results of that blood test for TMAO, there is a blood test for it, they can predict in 30 days if the person will have another cardiovascular event or not. So that's very important. So those are the effects. Now, this information began to come to the forefront and published in great journals like Nature. In 2011, there's a wonderful paper in Nature. It's been published in Circulation, Journal Circulation, the New England Journal of Medicine. This concept's been coming out as this is the toxic substance. As a matter of fact, TMAO it affects this outcome regardless of the cholesterol, the triglycerides, and the typical markers of cardiovascular disease that we have. So this is an independent risk factor for cardiovascular disease. I tell my patients about this because I think it's important. So let me just go to this next slide. What I wanted to talk about is this individual I have. This discussion is so wonderful. You know, I do get carried away when I talk about these things. The time is flying. But let me just tell you about this next slide. And so the question is, you know, okay, so how is the plant-based diet different? I want to emphasize that the gut microbiome is informed by what we eat.
Yep.
And if we think of it this way, we think of it, what we eat is the prebiotic.
Right.
What we have, what the gut makes is the probiotics. And then what comes out is the postbiotic. We can think of TMAO then as the postbiotic. So if someone's a plant-based vegetarian, your bacteria will produce things that promote health and help your body. Whereas if you eat things that, you know, cause harm, they will harm you. By the postbiotic will harm your body. Now, what does the plant-based food do? It does several things, and they're on the slide here. It replaces the disease-promoting foods. It reduces the LDL oxidation. But the one that I want to get to, really, it reduces inflammation. So let me tell you a little bit more story about this gentleman that I had. As I was mentioned, I'm in academic medicine. I'm the program director for the residency. I work in the hospital a lot, and I have residents. I had one resident that was a plant-based vegetarian, another one that was from another state where meat is what they eat, meat and potatoes. Mm-hmm. And so the one resident was trying to convince the other resident to try plant-based just for a week, just try it for a week. And finally he did. And at the end of a week, he said, wow, my mind has cleared up. And he came and told me, he said, Dr. Schwartz, you won't believe this. My mind is cleared up. Well, he went back to meat. And every time his mind got cloudy, he went back to plant-based to clear up his mind. Mm-hmm. And I thought, now this is crazy. How is this working? Well, what we know is that every high-fat meal creates an inflammatory storm in the blood vessel.
Right.
You can just see it. And so if you look at the endothelium, nitric oxide is the big deal in causing vasodilation so that there can be increased flow on demand. If you have a person who is eating a high-fat, high-inflammatory meal, that damages the blood vessel so that it does not produce nitric oxide. It blurs the whole mind. You can't even think. So we're used to thinking about, you know, the long-term effects. We need to control our cholesterol or diabetes because the long-range effects of heart attacks and strokes and so forth. But actually, we don't stop and think about the minute by minute, the hour by hour effect that or what we eat, what we take in affects our blood vessels. And this very much does. So you have an inflammatory storm. Breakfast, you eat, you know, bacon and eggs and whatnot. And then 4 hours later, you're eating another high-fat meal. The blood vessel is stunned. We talk it's stunned myocardium for 4 or 5 hours. Another 4 or 5 hours comes lunch. Then comes dinner. You're always in the fog. So this really is the issue related to the plant-based food and reducing inflammation. As you see, that also is beneficial to alter the gut microbiome. Right. So those two things are really important.
So I love that.
I could go on forever.
Wow, you know, and this is such an important topic because it's really, as you mentioned, it's really a fairly new topic in the last few years. And I'm sure that there are still a lot of healthcare providers that if you said TMAO, they would not know what that's all about. And
that's exactly right.
Helping them create that link. So actually, I have a question based on that. If Cleveland Clinic is measuring it in the emergency rooms, can you use TMAO in the outpatient arena as part of your cardiac evaluation, if you will?
Yeah, currently that is not taking place because it seems to be just only on the inpatient. I actually had a resident that took me up on this, and when we had a patient with a heart attack, she got TMAO levels, sent it to the Cleveland Clinic, got results back. It's amazing, but nothing yet on the outpatient.
Well, you know, and it really is interesting because we know that probably more than 50% of people with normal lipids, the standard lipid profile that we do, go on to have a heart attack or a stroke. So we know that
Yes.
we're not measuring the right things. And I've looked at
That's,
the Boston Heart series of
yes,
tests, myeloperoxidase, the plaque test. I
yes,
mean, there are other really important blood tests that you look at that can tell you if the endothelium itself is inflamed. And I
yes,
always tell people we have to talk about your ED, and they look at me, going to
yes,
talk about ED? What are you going to talk about? Well, number one, the real ED is the canary in the coal mine, and I talk to all my male patients about that. But you have to tell them ED equals ED. That endothelial
yes,
dysfunction is a real problem, and
yes, absolutely.
Dr.
Absolutely.
Esselstyn does a great, he gives you a great analogy, just the way you just described it. If I bang my arm and my arm gets a bruise, and then a few hours later I bang my arm again and it gets a bruise again, this is exactly what we're doing to the endothelium by
Yes,
eating 3 meals a day and bruising our endothelium 3 times a day. So it never has an
yes,
opportunity to heal. So
yes,
yeah,
yes, yes,
we have to
yes,
make sure that our audience really understands that, because it's important.
yes,
You mentioned in some of the literature that you sent me about the blue zones. So
yes,
we've talked about blue zones before. I'm sure that a lot of people on the line know where they are and such, but what do you see as the commonalities? And it's almost like the commonality in the CHIP program itself. There's
yes,
pillars, that
yes.
keep you healthy. And what are the pillars in the blue zones that people really should incorporate into their own lives so that they stay healthy?
Yes. Okay, so the blue zones, I lived in one in Loma Linda. And
Yes.
so and the blue zones, let me talk about two things, because the blue zones, I thought that was the greatest thing. But the Simani people of Bolivia, very similar to these blue zone people, and also the whole chip population. So if you look at these people, what really holds them together or makes them similar is their food choices
Right.
and the plant-based diets, the whole grains, the fruits, the vegetables, legumes, healthy nuts in good proportion, and seeds and so forth. That's what holds them all together. If you
Mm-hmm.
look, for example, and first of all, as far as the blue zones go, if you look at blue zones, they prioritize their plate with the plant-based. At the
Right.
side of the plate, only on some special occasions, they may
Right.
have some little bit of meat, but it's not the prominent feature of the plate. In the Simani people in the jungle of Bolivia, 72% of their diet is high fiber, complex carbohydrate. It's
Mm-hmm.
14% protein, 14% fat, but 72%. And it's interesting because those people up to age 74, if you look at their calcium scores, 85% of them have a 0
Yeah.
calcium score. And the rest of them have low calcium score, and then a low risk score, and then only 2% have a moderate or high risk score. 2%. In the United States, between the ages of 45 and 84, only 14% of Americans have a 0 calcium score, which tells you that the diet that links together, even the Mediterranean diet and the blue zones and the Simani people, has to do with a plant-based diet. Now, plant-based diet, tell people, it doesn't necessarily mean you eat all of your calories as plants. People have a kind of misconception, but it's legumes and beans and lentils and all these things. And 80 to 100% of the plate is plant-based.
Right. It's interesting you bring up the calcium scores, and for the people on the line that might not be familiar with that, the calcium score really is just a non-invasive way of looking at the arteries indirectly to get an idea if there's calcium buildup over plaques in the arteries themselves. And interestingly, I had a new patient yesterday, a 66-year-old guy that had a calcium score of 2,300. 2,300. And he was with 2 or 3 other physicians for an extended period of time, probably about 12 years, basically on either a paleo diet or a keto diet, despite the fact that he started out with a calcium score of 460 and ended up with a calcium score of 2,300 before he met Dr. Joel Kahn, who sent me this patient. And Joel said, you got to be on a plant-based diet. His score went down to about 900. And I spoke with him yesterday and I said, it really is unfortunate that you were seeing other healthcare providers that didn't really understand the significance of what you were eating and how that rising calcium score was increasing dramatically your risk for heart disease and strokes and cancers and dementia. The list just goes on and on. So, it really behooves us as healthcare providers, whether you're a physician, a PA, a nurse practitioner, a health coach, a CHIP facilitator, whatever, to really educate our patients on the value of these tests that really give you a significant indication on what that individual's prognosis is. So thank you for bringing that up, because that's really, really cool. And, one of the things that you also listed was the fact that a lot of people believe that you can't eat fruit or carbs and deal with insulin resistance. So tell us about your experience.
This is one of my soapbox areas.
Yes.
and at my hospital, I feel like I'm always doing battle with the dietitians, trying to get them to give a little better diet. But I think the issue with type 2 diabetes is insulin resistance. Obviously, beta cell function is the ultimate problem, but insulin resistance comes first. And the question is, what causes insulin resistance? So basically, let me just walk us through very quickly how sugar is handled when it comes into our circulation. So you let's say eat a piece of fruit. Glucose is released in the system. Insulin comes out of the pancreas. It binds the receptor on the skeletal muscle or hepatocyte, whatever. And through a series of mechanisms inside the cell, GLUT4 channels go to the surface and take glucose in. Insulin is the key that unlocks the door to let the insulin in to get the glucose to come into the cell. Well, what happens is, and this has now actually been shown by magnetic resonance spectroscopy, where they've seen ectopic fat in skeletal muscle and in hepatocytes. And so if people eat a certain diet, which is meat, you end up having some lipid subtypes. And those lipid subtypes include fatty acyl-CoA as well as diacylglycerol. So when you have these fatty subtypes, they impair and inhibit all those signaling mechanisms that allow the GLUT4 channels to go to the surface. In other words, intracellular insulin is not working. It does not pick up, it's not working. So what is really causing the problem is meat and fat in the cell. So now you eat the piece of fruit. So you have the meat causing insulin resistance. Now you eat the piece of fruit, the blood sugar goes up, and the fruit gets the blame.
Right.
It's not right. It's an innocent bystander, but it gets the blame. So that's the issue, is fruit is not the problem. There have been many studies looking at this same issue, and one of them was done by a wonderful researcher, Dr. Neil Barnard, and he was comparing, in fact, plant-based diet with the American Diabetes Association diet. No question, hands down, in terms of hemoglobin A1C, much better on the plant-based diet than the regular diet that had been prescribed. I had a funny experience one time. I went to see a patient. This is a 29-year-old about to lose his foot because he had very uncontrolled diabetes and whatnot. And my resident had been in before I was in, and we went together. And he said to me, "This guy's driving me nuts. He keeps asking for fruit." I said, "Give the man his fruit."
Right.
Give him the fruit. That's not the problem.
Right.
Stop the meat.
Right.
But it's really interesting. Yeah.
Yes.
So insulin resistance comes because of ectopic fat, not because of sugar. Now, excess glucose does have a problem, but the primary problem, and there are a number of mechanisms. If you look, I had another slide here. It's on the busy side, and it's not easily seen as well as I would like it to. But what it shows is that there are a lot of things in processed meat and also red meat, substances that go through a series of changes and end up with insulin resistance and type 2 diabetes. That is the mechanism. red meat, including the mechanism involving TMAO, it also causes insulin resistance. Advanced glycation end products, short branched chain fatty acids, short chain fatty acids, branched chain amino acids, all kinds of things all come together to cause insulin resistance coming from the meat. Now, what's interesting, if you look at this, there is no carbohydrate in meat. As a matter of fact, if you look at the numbers, in terms of causing diabetes or increasing the risk of diabetes, red meat and processed meat is one, and the ultra processed meat is the other. It causes 37% increased risk of diabetes. If you put the numbers all together, 54% risk of diabetes is because of the red meat and the processed meat. Yeah. And then if you look at the sugar sweetened beverages, it's 21%, not anywhere near what the meat is causing. And then if you look at whole grains, for example, the benefit of whole grains is just phenomenal. So I think basically, if you look at what really the problem is, it is the fat in the meat that people are eating that causes the problems.
Did you have another slide on that one?
Well, yeah, this slide. Let me show the slide. That's the last one with all the diagrams. You can see it there. This is, you're looking at the red meat and the processed meat, and when you look at that, you begin to see how all those things up there end up in one final pathway, which is insulin resistance and type 2 diabetes. And nowhere here, there's no carbohydrate in this. That's not the problem. It's the red meat and the processed meat. And I try to get my patients to appreciate this fact. So, yeah.
Yeah, and I like where you have listed there about the inflammatory markers that are a significant part of the problem. And now, as we're dealing with coronavirus and the pandemic, inflammation is a significant part. So you could even say that a plant-based diet should be absolutely part of the treatment for people that have the coronavirus, because we really need to decrease their inflammation. And we know that the long-term complications are dramatic, with people having so many problems. I saw a patient back in the office yesterday and, still having problems with cognition and renal function. So, as far as educating our patients, eat the fruit and leave the meat behind.
Let me just make one other comment, because you just mentioned that about the immune function.
Yeah.
So one of the things that to me that's just fascinating is the Dietary Guidelines Advisory Committee. It's a group of nutrition scientists, and they advise the U.S. Department of Agriculture. They meet every 5 years and advise what Americans should eat over the next 5 years. It always is that Americans should eat a plant-based diet. It promotes health. This year, and the document is very lengthy, it's like hundreds of pages long as I reviewed it. And this year they said two things need to be looked at the next 5 years. One of them was to look at the influence of the gut microbiome on health. That's just what we're talking about. Right. And secondly, to also look at nutrition and the immune system in light of COVID. Because if you look at COVID, the risk factors for COVID are identical to the risk factors for all the other cardiovascular disease and stroke and all that. So there's got to be some place in the middle where these things actually meet. I think a lot of it is nutrition.
Yes, absolutely. Well, we actually do have one question for you to answer from Amber. What can you say about supplement companies who promote L-carnitine and acetyl L-carnitine supplements for weight loss? And wouldn't those supplements potentially increase TMAO in the body?
Yes. And actually, that was actually done in a paper that was published in the New England Journal of Medicine. Yes, I would not take that as a weight loss supplement. L-carnitine is taking the pure stuff and feeding it into your body. Over time, that is metabolized the same way. It's oxidized in the liver to TMAO. So no, I would not take it. The experiment that was done was trying to give a plant-based vegetarian a steak, and they refused. So they gave them L-carnitine pills instead. What was interesting is because it's the long-term dietary habit that changes your gut microbiome. So if you give one L-carnitine pill to a plant-based vegetarian, the gut microbiome doesn't know what to do with that. They're like,
Right.
they can't even deal with it. But if you begin habitually to take that, it will change your gut microbiome.
Right,
Yeah.
right. And I can tell you, I ran a weight loss clinic at my old practice for about 12 years. The people that did the best really did their plant-based diet the way they were instructed. They got some exercise. They lost more weight. They were healthier. All of their markers improved. So, for everything that we deal with as internists on a daily basis, all of the chronic diseases that we deal with, plant-based nutrition is such a significant part of the foundation that if we just prescribe food, real whole foods, not the processed foods and all, we will have such a dramatic improvement in health overall. I want to look see if there's any more questions. Should a diabetic limit their initial intake of fruit when converting to a plant-based lifestyle?
Okay, so that's a great question. So let me just tell you a little bit about that. We can't get to, obviously time is really flying.
Yeah.
We're having such a good time, but let me just point you to one study that was done, and it was the first of its kind, huge study done in China, 500,000 people, and it was a 7-year study, 500,000 participants. It was both a primary prevention and a secondary prevention trial. And they would usually we think of giving people vegetables, that's safe, but fruit, what's fruit going to do? And so they gave people fruit, and they looked at them over time. In terms of primary prevention, it delayed people or prevented people from developing diabetes. If they already had diabetes, the intake of fruit, which was significant amount of fruit, actually delayed the onset of the complications of diabetes.
Right.
Now, they don't know the exact mechanism. What I will say is this. I believe there are probably two different types of fruits, perhaps. The northern hemisphere where we live and the southern hemisphere. You're looking at glycemic index, and glycemic index is something that's a little difficult to get right off the bat. But glycemic index has to do with what is the blood sugar response after eating a certain carbohydrate. And it is standardized to some things like white bread and glucose and etc. And so based on that, my recommendation is don't go eat the whole watermelon or all the whole pound of grapes, but begin to introduce fruit into the diet. And I actually believe that you'll find that you'll feel better. And as you cut back, cut out the meat, the body begins to get better. One of the big things so far is the mechanism of insulin resistance is ectopic fat. Like I mentioned, it comes from obesity. And so weight loss, getting the weight down, getting the cells down to better size is going to be really helpful. But fruit really is not the primary object of trying to limit the diet. You want to have a good, well-rounded plant-based diet.
Right. So lots of vegetables, a few fruits per day, all the other things that you mentioned, healthy fiber, legumes and beans.
Yes. And whole grains.
Right.
I didn't mention whole grains. If you look at all the things that cause the blood sugar or diabetes, increased risk of diabetes, processed meat, red meat, sugar sweetened beverages, the one thing that improves it, this study was done looking at 12 different food groups, and they picked out 6, and these ones. So the only thing that showed any benefit on blood sugar control was whole grains. The mechanism is elegant. And basically what you're looking at is cereal fiber. Cereal fiber is important. It has to do with how the gut is bacteria are transformed. So the cereal fiber is really transformed by gut bacteria into short chain fatty acids.
Right.
For short chain fatty acids have a lot of diabetic issues. One of them is glucagon-like peptide. I know that it's about out of time, but it increases insulin sensitivity. It increases this substance, glucagon-like peptide, which is imperative in utilizing glucose. So it is really a wonderful thing. Cereal fiber, whole grains, whole grain bread. Diabetics can eat whole grain bread. Don't eat the whole loaf, but certainly you can eat good whole grain bread. and whole grain cereal and not have to worry about it, because it does something important on the cellular level and the metabolic level to improve glycemic control.
Well, we could talk for hours on these topics. I love everything that we're talking about, but before we let you go, you talked about food choices, prioritizing your plate. You basically reiterated what Michael Pollan says: eat real food, not too much, and mostly plants.
Yes,
so we have to keep that in mind. But I think you have to give us the answers to the poll questions.
Okay. Yes.
So
okay.
The number one there, which of the following is the number one source of calories among Americans age 2 and up?
It is dessert. It is dessert.
Right.
It is these refined grain desserts. That's the number one source of calories. Now, I want to mention something else that's interesting. If you look at Americans getting their calories, the number 3 thing is chicken. And I have to tell you this because it's almost funny. Americans eat 1 million chickens an hour, 25 million chickens a day. And chicken is also bad for your health. All right, next question.
No, here we go. The protective foods. So which type of foods are most protective against type 2 diabetes?
Okay, I bet some people said, because people always say it's the berries, or it's the cruciferous vegetables, but actually it's the whole grains. The whole grains. That's the most protective of all the foods that they looked at in this the studies. Whole grains are the most protective for diabetes. And
that's amazing, because those are some of the things that traditional physicians will say, no, you can't eat whole grains, you can't eat breads and all. So before I let you go, what is the one take-home message and the one action plan that you want our attendees today to remember and start doing today?
What I tell my patients is don't do everything all at once. Mm-hmm. People have acquired dietary habits. I say to people, just try one day doing plant-based, truly plant-based, nothing canned, plant-based, and try that one day, see what happens. Then expand it to more. Eventually, try for a week and see what happens. As you begin to enjoy your clear mind, etc., I think it'll change your habits.
Well, I'm sure that you've helped to clear the minds of everybody that's on the line today. I thank you so much. This was really an exciting, very educational and fun discussion. So I want to thank you really for not only for being on the show, but really for helping to educate the up and coming physicians, all the medical school students and residents that really need to know that this is the first prescription that they should be writing. So, when I take out my prescription pad, I always tell my patients the first prescription that I'm going to write for you is what you're going to eat every day. So hopefully our residents can start doing the same thing. But Dr. Schwartz, thank you so much for being such a wonderful guest. I really appreciate you being on the show, being an advocate for the CHIP program and for everything that we do for lifestyle medicine.
Thank you, Dr. Sal. It's been a wonderful privilege being able to chat with you and your audience as well.
Absolutely. You stay well. God bless.
Okay. God bless you. Bye-bye.